Hello everyone, my name is Colin Bates and I'm here to introduce a public health policy related to prescription opioid abuse. So we all know that the past several years Massachusetts has faced this epidemic of opioid deaths, opioid abuse, and addiction. And in 2008 alone, which is quite a few years ago, and you can imagine the numbers have risen, but in 2008 alone there was 36,000 deaths related to opioid abuse. So most opioid abusers actually get it legally prescribed to them from their providers. There's a very small percentage of abusers that actually go out looking for it, whether it be an internet source or from a drug dealer. But the hard thing about it is that as healthcare providers, you have to believe that your patients are in pain. So whether it be chronic or acute pain, you're required to treat that. But by introducing a monitoring program, an online database that shows you what your patients are getting in terms of medication, and not just opioids, but benzodiazepines and other controlled substances that can lead to addiction and substance abuse and unhealthy behaviors and even death. So this program would allow providers to monitor what their patients are getting and how much they're getting and when they're getting it. It's known that a lot of opioid abusers tend to shop around prescribers, so they'll see multiple people for the same problem, and they'll be able to get multiple prescriptions for the same thing. And with this program, with this database, prescribers and physicians would be able to see how much their patients are getting and who's getting what. It can help identify potential abusers. So it's really beneficial in terms of decreasing the numbers of fatalities related to opioid abuse. The impact would be such that the monitoring programs and the databases would help to decrease opioid fatalities and deaths. It can begin to intervene with addiction and abuse before it even happens. Prescribers would have to be limited in what they're prescribing because they could see what their patients are getting from other providers as well. And pharmacies would also have access to this and be able to see what they're getting. They're filling a script for a patient, but maybe they see that the patient just had the script and they could put a stop to it, and it would just really decrease the number of deaths related to opioid abuse and hopefully lead to some sort of treatment or intervention before that fatality or death happens. And if there's no program or nothing implemented like this, there's just going to be an increase of fatalities related to opioids and prescribed medications. Thank you for listening to me. I hope I made a good argument.